The kidney meridian of foot Shaoyin. The kidney meridian starts from the metacarpal pad and goes inside at the ankle, goes around the medial malleolus, and then goes up on the inside of the leg, and then it goes all the way up to the abdomen, goes below the navel, and ends at the chest. The landmark acupoints are K1, KI1, KI6 on the ankle, KI10 at the back of the knee, KI21 on the abdomen, and KI27 on the chest. The first acupoint is KI1. It is caudal to the metatarsal foot pad. Next, there are a lot of acupoints on inside of the ankle. KI3 is in between the medial malleolus and Achilles tendon. And caudal from KI3, at the insertion of the tendon, there is KI4. And right below KI3, there is KI5. And in the depression right below the medial malleolus, there is KI6. From KI6, you go a little up to the distal end of the medial malleolus. Too soon above the medial malleolus, at the insertion of Achilles tendon, there is KI7. And next to the knees, at the back of the knee, a little inside of the bladder meridian acupoint BL40, there is KI10. KI1 is caudal to the big paw pad. It is at the back part of the paw pad when the paw pad is attaching the ground. There's KI3 in between the medial malleolus and the Achilles tendon. And caudal to KI3, at the insertion of the tendon, there is KI4. And right below KI3, at the base of the calcaneum, there is KI5. It is in the depression cranial to the calcaneal tuberosity. Next is the ankle. On the ankle, there is KI6. It is right below the medial malleolus. Then we go up along the Achilles tendon and too soon above the medial malleolus, and then sliding your hand back to the Achilles tendon, you have KI7. At the back of the knee, on the knee flexion crease, in the center, there is BL40. A little inside of BL40, there is KI10. Here we have the tendon of the semitendinous muscle. And on the outside of this tendon, there is the tendon of the biceps femoris muscle. BL39 is medial to the tendon of biceps femoris muscle. BL40 is in the center. KI10 is lateral to the tendon of the semitendinous muscle. The first acupoint is KI1. It is caudal to this pad. Then you go up and around the medial malleolus. In between the medial malleolus and Achilles tendon, in the depression, you have KI3. And at the calcaneus, at the insertion of the Achilles tendon, there is KI4. And straight down from KI3, cranial to the calcaneal tuberosity, there is KI5. And at the ankle right below the medial malleolus, there is KI6. Then go 2 cm above the medial malleolus and then slide your hand towards the Achilles tendon until it stops. This acupoint is KI7. And at the back of the knee on the bladder meridian, there is BL40. Medial to BL40, there is KI10. KI10 in the inside, BL40 in the middle, BL39 in the outside. You'll be able to know the difference only by palpating these points. And yes, there are these 3 acupoints aligned in the knee flexion crease. Okay, next is the abdominal region. Next is the abdominal region. In the abdominal region, the kidney meridian runs 0.5 cm lateral from the navel. And in the thoracic region, the kidney meridian runs 2 cm lateral from the midline and goes all the way up to the first intercostal space. The landmark acupoints are the navel and the xiphoid process. In the abdominal region, the acupoints are KI17 and KI21. On the line connecting the navel and the xiphoid process, 2/8 from the navel, there is KI17. And 2/8 from the xiphoid process, there is KI21. And both of the acupoints are 0.5 cm lateral from the midline. And the very last is KI27. It is at the cranial border of the first rib, 2 cm lateral from the ventral midline. It is the last acupoint in the kidney meridian. In the abdominal region, the kidney meridian runs upward, 0.5 cm lateral to the midline. And in the thoracic region, the kidney meridian widens to 2 cm lateral from the midline, and then ending at the cranial border of the first rib. On the line connecting the xiphoid process and the navel, 2/8 from the navel and 0.5 cm lateral to the midline, there is KI17. And then 2/8 from the xiphoid process, 0.5 sun from the midline, there is KI21. And then going up to the first thoracic vertebra on the cranial border, and 2 sun lateral from the midline, there's KI27. The abdominal region of the kidney meridian. Landmarks are the navel and the xiphoid process. On the line connecting the navel and the xiphoid process, 2/8 from the navel and 0.5 sun from the midline, there's KI17. And then 2/8 from the xiphoid process, 0.5 sun from the midline, there's KI21. And the very last acupoint is at the first thoracic vertebra. It is at the cranial border of the first thoracic vertebra. And 2 sun lateral from the midline. It is the KI27.